All right, so let's talk about what inflammation is first, because we know that inflammation plays a role in a lot of the health concerns that we are facing right now. It has a part to play in coronavirus, COVID-19. It has a lot to do with our acute illnesses and our chronic diseases. So if you guys want to chime in, how would you describe inflammation?
Well, the way that I describe it to my patients is it's a sign that your body's angry, basically, or think of it as going through a firewall, essentially. Kind of helps to explain in a simple way. Or if your cell is having to work overtime by cleaning out, or by just working overtime by having to work through pain, or if you're eating something that's not working well, pretty much if it's working through anything that's not beneficial to your system, then it causes extra garbage to fill up around outside the cellular area. And that garbage starts to collect and then can get into your blood vessels, into your joints, causes pain, headache, and all kinds of havoc. So it's like a general way to explain to a patient, to a layperson, is, but it's basically your body is not happy.
Yeah, I mean, I think I probably would just add, that's a great explanation. I mean, I think one of the things that we have to remind people of inflammation is that, it really is your body's attempt to make itself better, and sometimes the body has a hard time telling when it should, stop, or how far it should go with it. And so that's why we feeling the pain, we're feeling all of the garbage, as Dr. Kwame eloquently said, around there. Your body's really having trying to get itself back to its square, trying to get back to maintain that old word homeostasis, right? But that's what it's trying to do, and so we have to manage that sometimes, because it can sometimes go overboard with it.
Okay. Dr. Rachel, do you have anything to add?
I think everything they said was fantastic. I mean, again, our body has the innate ability to heal itself, and inflammation is just that signal to say, hey, there's something going on. Let's try to help assist. And everything else everyone else said.
All right. So inflammation is not always a bad thing. And I'm just telling that for the people who are watching, that inflammation is not always a bad thing. As Dr. Thompson mentioned, it's how your body goes in to correct itself. Whether you had a trauma, you were hit, you were stung by a bee, you bumped your toe against a table, you fell, you, as Dr. Kwame said, you ate something that your body didn't like. So it's a way that your body is trying to repair, but it can go really, really badly. So in your practice, docs, what are some of the ways that you have seen inflammation play its way, inflammation show up?
Well, I know for me, one of the main concerns that I see a lot, is what I think is termed, we call silent inflammation, silent, because I think a lot of times people, we think about inflammation and we expect to see, swelling, we expect to see redness, we expect to see pain, we expect to feel like some heat on there. But a lot of the inflammation that a lot of people deal with that are extremely detrimental to health is stuff that we don't see outwardly that way. Mm-hmm. And a lot of it is due to, poor diet, poor gut health. And so the body now is reacting in a way internally that is having outward manifestations. And that's what I see a lot.
What do you mean by gut health for people who don't know what that means?
Right. So our inside of us, our intestines, our stomach, we have a lining there that helps not only with absorption of our minerals, but it houses a lot of our immune system. And so when we eat things that we have allergy to, it causes a disruption in that lining. And in turn, that it may be damaged. And so now you got other things trying to get in there. And now your body's like, what the heck is all of this? what is all of this stuff about? You know, and so what I see a lot of times is, you know, somebody may be allergic to something. I mean, they may not even know they're allergic to something, but then they're eating something that's causing that to be more damaged. And now there's things getting into your bloodstream that your body, you know, that doesn't belong in there the way it is. So now it's another foreign thing that the body's looking for. And so, yeah, that is something that needs to be repaired to stop that.
How have you guys seen it play out in your practices?
So what I'll see is patients will come in, they'll present to me and they'll say, you know, either I'm having low back pain or I have high blood pressure, I have high cholesterol and those types of things. And so the initial thing that I like to do is to take their case, but to also get some lab work to kind of see, you know, checking their CRP, which is a marker that can indicate if inflammation is elevated in the body. It's kind of like a generic way to look at it because you really don't know where that inflammation is occurring, but you can see that there is a increase in inflammation in the body. And just what Dr. Thompson was saying too, the delayed reaction. So you have this IgG and you have the IgE. So the IgE is this quick anaphylactic response that you have to an allergen that can create this inflammation. So let's say you ate peanuts, your tongue swell up, you know, you can't really breathe, you're having an immediate reaction. Now IgG is a delayed reaction. So just like Dr. Thompson was saying, you've been eating, you know, certain foods and you don't really know that you have this allergen to it, but you've been eating it for a long period of time. You're like, well, I've been eating this. I don't have any type of reaction. I'm not having any inflammation, but you are, and it's occurring on an inner level. And so basically running and looking at, you know, food sensitivities to see, you know, what true allergens that you have to respond to that inflammation. So that's what I like to do in my practice.
Okay. Dr. Q, how does inflammation play out in your practice?
I see it a lot of times with autoimmune conditions. So people will come in with Hashimoto's or thyroid. A lot of thyroid conditions have elevated CRP, as you mentioned, or elevated homocysteine, or they're elevated. So people come in with a lot of chronic conditions. They'll have these pre-diagnosed conditions, again, with autoimmunity. Lupus is another one that tends to be really elevated with your inflammatory markers. So fibromyalgia, a lot of like those long-term, seemingly idiopathic, we don't know what to do, we can't really treat it, just really non-specific conditions, but also some level of autoimmunity going on. Then, like you mentioned, I'll do the labs, and you'll find that I find that specifically, I think, with a lot of thyroid conditions, their inflammatory markers are really elevated. They tend to they're trickier to get back down, but once we calm them down or put the fire out, as I say, then those inflammatory markers tend to slide back down. And then calming the system down basically means, for one, checking to see how inflamed your system is by doing the intake to see how your symptoms are, but also backing it up with the labs. And then readjusting your diet so it's more alkaline or more calming to you, taking away those foods that your body's reacting off, as you both mentioned. I love how we're all practicing the same way. It's so exciting. Working on the basics, getting your sleep back in track, getting your stress. Stress is huge with inflammatory conditions. It's like the thing, stress and food, especially with autoimmune. I tend to see once we start focusing on those two, get you moving, getting things flushed out, then those numbers start to slide back down. Your symptoms tend to go away. Your body starts to reach that homeostasis level again. So it's kind of, I don't want to say fun, but for me, I like seeing that because I can see the steps. People they come in really inflamed, really in pain, really out of balance. We do those steps one by one, and then they feel better and off they go. So it's kind of nice to see that happen.
So for me, what I see is that inflammation has a hand in almost every condition, as I've mentioned earlier. Atherosclerosis and arteriosclerosis. So if you have plaques forming in your arteries, that will lead you to conditions where you will have increased blood pressure or vessel blockages or any kind of diseases like that, that is an inflammatory disease. Obesity, is an inflammatory condition. Hypertension is an inflammatory condition. Diabetes is an inflammatory condition. Most pain has a lot of inflammation along with it. So for those of you that are watching, keep that in mind, that just about everything that we see in our practices and a lot of what's going on in the body has a lot to do with inflammation. And so if we can understand what the inflammation is, understand where inflammation goes from being a good thing to a not so good thing, and start to manage it, it can really start to save your health and save your life. Reminding everyone who is watching, you can ask questions. So make sure that you post your questions somewhere in the chat and let us know what your questions are, and we will do everything that we can to answer those questions for you. So stress. We talked about stress. Let's talk about how that manifests, because stress is huge, especially now that, we're in the middle of pandemic. Most of us can't go to work. Those of us who can go to work are, a lot of us are stressed out who are at work, who are physically at work, essential workers, or, people working at all of these jobs, whether or not they are able to wear masks or protective equipment. If you're not able to go to work, what stresses does that put on you? Being home with the children all day, every day, being, having to have the food with you and having to understand when you can leave out the house or who's more at risk of the disease. So let's chat. Let's talk.
Well, I will say in private practice, in DC, naturopathic doctors can recommend patients for medical marijuana. And I have seen an influx in patients reach out to me for anxiety, requesting medical marijuana. And I know there's a lot of literature out there where patients will see, CBD, it has a anxiety. So, but I've definitely seen an influx in patients with anxiety, especially due to this COVID-19. So what I try to do is definitely get to the root issue. So what's causing anxiety, whether it's COVID-19, whether it's past trauma, what are those things, those root things that are causing it, and work with my patients to try to develop coping mechanisms through those stressors. So whether that's just taking a second to, take some deep breaths, or listening to free guided meditation videos you can find on YouTube for reducing stress. But stress definitely is harmful to the immune system. It can weaken the immune system, and that's something that you definitely do not want right now with this pandemic.
Yeah, stress, it's a huge thing, obviously with the COVID-19, and to be honest with you, in life in general in this country, we be stressing ourselves out, man, about, in this sense, in some sense, I would say COVID-19 has probably helped some people. Obviously, to be able to kind of slow down and maybe help their bodies to rebalance. Obviously, respect anybody who has lost any loved ones, but when we think about stress, there are hormones that are produced, through stress, and epinephrine, norepinephrine, and those are good things, because we got this fight or flight, this sympathetic nervous system, this fight or flight response that's going to happen. We need those things to get away from that bear that's trying to chase us down in the forest, what have you, right? But when we have too much of those things constantly, and now we're producing hormones that are going to be pro-inflammatory. A set of hormones. We got cortisol coming in there. It becomes pro-inflammatory. And so with that being said, we got a lot of people who sitting at desks and things of that nature who got epinephrine and norepinephrine all day long.
That's out all day.
And so literally building up all kind of inflammation, right? That is inside. Now I got to say this about inflammation. When we talk about inflammation on the inside, we're talking about little blood vessels that are swelling up. We're talking about tissues that are swelling up and preventing things like blood flow. Right? You know, that stuff that carries oxygen to your body, you know. I mean, we got inflammation that's stopping that from happening. You know, as a matter of fact, you wonder why some people at your office, maybe they're not thinking right because they got information that's preventing them from being able to think right. You know, it's got people on emotional, you know, highs and lows, and you know, that's what it's doing. That's what it's doing. You know, so we got to be mindful of that. You know, and that's why, for instance, when you get a patient that comes in with all sorts of anxiety or stress, I mean, one of the first things you might say, hey, look, man, look, can you like take a few days off? Let's take your multivitamin.
Right.
What do you like to do for fun? Let's go do that. Let's relax a little bit. Give them some adaptogens, you know, to kind of calm them down. You know, you know, that's one of the first things that I try to tell patients.
Mm-hmm. Yeah, after that, I was going to mention, I tend to explain both stress, for one, I approach with every single patient. It affects everyone, all of us, and it just depends on how your particular system shows that level of stress, but it throws your system all the way off, because kind of going off what you're saying with the parasympathetic nervous system, when your body's in fight or flight or sympathetic, it's not focusing on healing. It's not focusing on regenerating. It's not focusing on hormone regulation, on sleep-wake cycles, on metabolism, because your body's focusing on getting to a safe space. And so when you're sitting at that desk all day long, your body's going to be focusing on running from a tiger while you're sitting at that table. And you're not running things off at the same time. So that adrenaline builds up over time and starts to stress your system out. Then your blood vessel starts to get less flexible, and inflammation build. So you get more stuck in fight or flight. It gets hard to fall asleep. It gets harder to break down your foods. You start to get GI symptoms, or constipation, or bloating after eating. You don't know why. People come to me, they're like, I don't know what to eat anymore because all the food I'm eating is affecting me. Because most likely a part of your system, or a large part of your system, is stuck in fight or flight and is not checking on breaking down food because it's trying to run from a tiger all the time. So we talk about, again, taking those deep breaths, doing things that help to ease your system out of sympathetic into parasympathetic, so it can learn to relax again. Because the more that we're stuck in sympathetic, we're going to be focusing on those regenerating, healing activities that our system needs to be doing on a regular daily basis.
Yeah. And I think it's important to note here that this is not something that necessarily going to happen overnight.
Amen. Right.
It's not going to happen overnight. I mean, it took a while for you to get where you are. I mean, you were stressed for a while. So it's not going to happen. But, you know, I think we have to say that, because particularly since we're dealing with natural medicine, you know, because sometimes what we get, the expectation is that, hey, I'm going to take this pill and all my anxiety going to go away. But the reality is that, you know, it's something that is going to require a lifestyle change. We got to figure out how to keep ourselves calm. We got to, hey, it might mean you need to change jobs, right? It may mean, you know, you might need to tell somebody to move out. I'm sorry, I'm meddling. I'm sorry.
Actually, you remember, so all of you work with Dr. Swan. Y'all had at least one class. So we had an instructor in school who, I remember one time when I was shadowing her in her clinic, she said, yeah, she needs a husbandectomy. I was like, oh. So to prove your point, Dr. Thompson, sometimes we got to get rid of people in our lives who are causing us stress and inflammation and pain and all the things.
Getting to that root issue, for sure.
Get to the root issue.
Yeah, that's the root.
like all these things could be happening in your body, but the root is you just don't like that person.
Yeah,
and you live in nerves. And you got to, it's got to go. So that might be the thing to do. Yes.
But no, go ahead. I'm sorry.
No, go ahead.
Well, I mean, I was just going to reiterate. You know, I just want to make sure everybody understands it. Again, it's not something that is going to happen overnight. It's something that's going to require lifestyle change. And then again, that may mean, you know, the operative word means change and lifestyle. I mean, it's going to require that maybe you really be really intentional, super intentional about how you live, what you eat, who you're around, what you do. You know, I mean, I know for me, you know, personally, you know, people who know me or talk on the phone with me, they know like around 9 o'clock or so, you know, I ain't really trying to FaceTime because my lights are off. You understand? Like, I got my lights off because I know for me, I need to bring myself down. And I need to do it starting around that time. So, hey, you know, I know you want me to turn this light on. I'm not doing it. You know, so, you know, so we got to make some decisions that may require a certain level of sacrifice, but you got to make a decision. I mean, you know, am I going to do what I got to do to be well or not?
You know what's interesting too, and something that I found is sometimes patients don't even know they're stressed.
Yeah.
Right.
Like, oh yeah,
Absolutely.
I guess I am having increased heart rate and shortness of breath, and my hands do get sweaty, you know. And I'm just like, yeah, you know, that could be stress, it could be anxiety. And I think making sure that we're really educating our patients, you know, on, you know, the common symptoms is definitely important as well.
Absolutely.
So let's talk about some common symptoms, because I have family members who are like, I'm not stressed, and I'm sitting there looking at them like, are you sure? Because that looks like stress to me.
Mm-hmm.
So what are some of the telltale signs that you guys see of stress?
For me, I tend to see a lot of women, and they, like you said, women or people, I guess, tend to just go and push through. They're high functioning. They have these intense lives. They got these jobs going on. They're raising their kids. They've got the mothers that they're trying to help with chronic conditions, and they're just going. And so they're coming in. They're like, I can't sleep, or I'm distracted, or I'm waking up in the middle of the night and I can't fall back to sleep. It needs to be the first thing that tends to go for people. They either have a hard time falling asleep or staying asleep. And so once I talk about, well, how the stresses of your lives, and they tell me a little bit about that, and I ask them, well, how well are you managing that? And they kind of get silent, like,
Manage. What is manage?
No one's asked me that, you know? So it takes a moment for them to realize, oh, I am dealing with a lot. And maybe towards the ones that are really stuck in that fight or flight, a lot of them don't even know that they're in it, because it can give you a little bit of a high, honestly, with the endorphins flying through. And Americans in particular, I think, are really stuck in doing everything, doing all. It's like we have a competition of, I'm doing the most. How are you doing? You doing the most? I'm doing the most. And so it tends to be difficult for those particular personalities to talk them down off of that, to say it's okay to rest. You actually need to relax. You need to figure, and a lot of times people don't even know how to relax because they're, again, stuck in sympathetic. And so it takes a few sessions sometimes to get them to calm down from going 800 to going away from that high from 800 to a neutrality and going, okay, now this is where I should be. Neutral is where I need to be. So sometimes it takes a little bit of coaching on my end, but yeah, I tend to be, sleep is the first thing to go for people.
I know what I've seen. You see insomnia a lot, but you also see things like insulin resistance. You see weight gain around the midsection. You know, you see that all the time. You know, and man, I can't seem to. I don't know what's going on. I ain't never been this big in my life. You know, and they you know, doing all kind of stuff, you know, to try to lose weight, running, and like, man, why is it that I can't lose weight? You know, and you know, and so, you know, these are you know, common things. I mean, the reality is I think, you know, inflammation is a major factor in most degenerative and chronic disease. You'll see people who are wondering why at the age of 30 they feeling like they got arthritis. You know, they having joint pains. You know, wondering why, you know, they can't sleep and having a weight gain, and it's stress.
I often see patients that feel overwhelmed. They feel like, oh, I'm just feeling overwhelmed. Or I'll see inability to focus. See a lot of that. They're like, oh, I think I have ADD or ADHD. I'm like, no, it may just be stress. Also insomnia, I'll see a lot of that with the elevation of cortisol for sure. With that weight gain around the midsection, I'll see that. Increase in heart rate, shortness of breath, sweaty palms, I'll see that. I'm sorry, I'm just going through this checklist of all the things that I typically see. But yeah, those are the major things that I see when I notice that patients are stressed.
Mm-hmm.
I was having a conversation. This was a conversation over social media, a private message with somebody, and we were talking about blood pressure. And this person was on quite a few medications, like not just one or two, but like numbers of medications just for hypertension. And they were like, I've done everything. I've seen all the top docs. And my first thought was, have you seen a naturopath? Because I know you never told me. So you have not seen all the top docs, but that's neither here nor there. Well, no, that is here. But the thing is, one of the things that they said was, I've changed my diet. I've lost the weight. I can't do anything about the stress. So what can I do? And my thought was, absolutely, you can do something about the stress, right? You can't do anything about the people around you, but you can do something about how you respond to it, how your body handles it. And so as these docs mentioned, we are talking about, learning coping mechanisms for stress. You can use, change your eating habits to foods that your body actually likes. Not every healthy food is going to be a good food for your particular body. Kale is great, but not everybody can eat kale. Right. Tomatoes are wonderful, but not everybody's body can digest tomatoes. So, starting where you are, starting with what is fantastic, but then you have to refine it after a while because, again, you're a unique individual. And so using herbs, using food, and again, back to the food. So if you're eating foods that your body doesn't like, that causes internal stress. And then that can also manifest into this external stress. And then you can't sleep, and then that becomes a vicious cycle. So there is that. There is that.
Too. I've also seen elevated blood pressure from stress.
Right.
So, yeah.
Exactly.
I think what you guys, I think you guys are saying is really important. I think because, there are a lot of people, when we talk about kind of that silent inflammation that's happening. And the reality is, this is why, well, let me say it this way. This is why it's important to find your naturopathic doctor. I'm just being real with you because we know what we're doing, and we can help you to be able to understand what is particular about your body. Okay, because here the reality is, you can go to a nutritionist. God bless the nutritionist. God bless you. But here's the thing, I can go to a nutritionist and they can tell me what's on that food triangle. Now, don't get me started on that, please. They're going to give you something off this food triangle, okay? And we all know, well, we should understand that that's a bunch of crap. To be honest, sorry, I said the word crap. I'm sorry. But, that triangle says, hey, you should eat. To be healthy, you need to eat a certain amount of wheat. You need to eat a certain amount of dairy. You need to eat a certain amount of fruits and vegetables, et cetera, et cetera, et cetera. But the reality is, over half the people in the country are allergic to wheat and don't know it, right? Because a lot of stuff is genetically modified. You're basically eating wheat that's mixed with weeds. So you go outside, you have an allergy. Whew, I'm sneezing and stuff. They got this weeds outside. It's called you, but then you go eat some bread that got the weeds inside of it all. Right? So, we need to be able to, I need you to go to the experts and find these things out, because a lot of us are eating things and we're trying to be healthy. And that's the thing. you got to give people some grace and some compassion to say, hey, I know some of you, you're doing a good job of trying to be healthy, but what you're eating, you don't even know it's not good. You don't even know that. And so I think a lot of people are suffering from that. You know, I had to go through some of my relatives' pantry and be like, hey, trash, 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 trash. It's okay. Trash, right? Because they don't know. They just don't know. And so we, Dr. Callens has said this several times. We have to educate people on what they need to do, even if it's for their own body, right? Yeah. Now, I think that people can tell us kind of how they feel that maybe better than I can, because it's their body. They didn't know that. But they don't necessarily know what's best for them.
So, I agree. I think that's what makes us specialists. I know oftentimes I hear colleagues refer to themselves as primary care doctors, but we are specialists. We specialize in naturopathic medicine. We are trained in 2 years of nutrition. You know, we don't take just a weekend course and call ourselves, and I'm not discrediting anyone, but we don't call ourselves functional medicine doctors after a weekend course. We have 4 years of training to qualify as naturopathic physicians. Mm-hmm. And with that training, we can develop tailor-made programs for our patients. So just like you were saying, Dr. Turshá, to look at, foods that are perfect for you, because you may not be able to eat kale. You may not be able to eat, tomatoes or whatever, but developing that program that's tailored for you that's our goal.
One thing that I want to mention that sort of has come up so far is I want everyone to realize that it's okay to modify things as you go. As you learn better, do better, right? And so when you're starting off on any journey, whether it is a new job or it is a new baby, being a parent for the first time, or learning how to eat well, or, how to exercise properly, you go with what you know in the beginning. And then as you get more comfortable with that and you learn more, then you start to switch things up, so that now you're able to tweak and pivot, right? And so if you have started eating, whole wheat products and dairy and, yogurt and all the good things and all the, the tomatoes and the eggplant, all those fresh vegetables, and you're feeling better, but then you're not feeling as great, it's okay to pivot. You might learn that, as we said, your body does not actually like those things. And so keep that in mind, that this whole thing is a learning process. Medicine is called a practice, not because people are experimenting on you per se, but people are experimenting on you because everybody is unique. Like, we know certain things, and we know how things are supposed to look, how things are supposed to act by the book, but none of us are the book. So there are going to be some differences. And so keep that in mind, that as you move on your journey of health, as you try to decrease inflammation or, decrease your autoimmunity, release some weight, drop your blood pressure, get your blood sugars under control, learn something, and then be okay with modifying what you learn, because that will be the key to you continuing to heal along the way.
Yeah, I think that's important to mention, because a lot of times patients will come in who want that quick change that you mentioned, Dr. Thompson. You got to think about, the body is an organic being, and it doesn't work well with large changes. It's going to cause it to go into another level of. Do you want to go through small, consistent changes so the body can get used to that and then readjust? And then you check back in, you make another change, the body can readjust. And then you make another change, body readjust. You don't want to just throw everything, the whole kitchen sink at the body. It'll react in a negative way, even if those individual things are helpful. You want to go slowly so the body can, and you can understand those changes and keep those changes for another lifestyle change, and keep them in for staying healthy as possible. Just wanted to add to that.
I got a comment, and I want us to address it. Dr. Thompson, I'd like you to address it first. Okay. It was said, the comment is, I beg to differ with the statement of downplaying nutritionists and dietitian. I think we could all work together to help our community.
Okay. Yeah. I mean, well, I think like all of us said, we're certainly we're certainly, you know, not trying to downplay anybody's role in that. And you know, and what I said was not directly aimed at, you know, to talk badly about a nutritionist. But what I mean, you know, you can put anybody's name, whether you trust a nutritionist as your dietary authority, whether you trust your mother, whether you trust whoever it is. I think that we have. I think naturopathic physicians have a special training, being that we have clinical training, kind of as a primary care physician. I mean, I think it gives us a kind of a special leg up in that sense. But my point was that we need to make sure that we are, you know, taking that we're considering everything that you know what Western medicine is saying in terms of what we ought to eat as healthy. We need to reconsider that in light of what's really best for us as individuals. And that's all I was really trying to say about that, was that, you know, and listen, you know, whether it's coming from a dietitian or anybody, and I'm standing by this. What we're taught as in terms of Western medicine as what's healthy may not be healthy for everybody. You know, because you look at what the USDA is telling us is healthy. You look at this triangle or whatever it is, you know, however they're saying this now, it makes the assumption that everybody's body is healthy if you eat this and this and this. And I will stand by, you know, what I believe, that is a false narrative. It's a false narrative, and I think it is leading to an increase in chronic illness. It can lead to an increase in chronic illness. You know, I don't want to offend nobody, but I'm, you know, and I'm not trying to say anything bad about any other sort of health profession, because I'm as integrative as they come. I'm integrative. You know, I remember meeting some, you know, what I would call old OG naturopaths, right? You know, and they was like, look, we can't work with those people, you know. But I think the reality is, I think we have to.
Yeah.
If you are truly interested in the health of your patients, if you are interested in creating a healthcare system that is not just interested in treating symptoms, but one that is willing to increase wellness and teach wellness in a preventative manner, I think that we all have to work together. MDs, NDs, DOs, nutritionists, nurses, whoever it is. The goal is for people to be well, and that's why I made that statement.
One of the things that I noticed, I was working with a friend of mine with her diabetes. This was some years ago, and you know, we had completely changed her diet. We had talked to her prescribing docs so that he could modify her medications, and we were getting her blood sugars under control. Fast forward, she had to go into the hospital for something completely different, and in the hospital, they gave her a diabetes diet, which was completely against what we were eating. And she said, I don't want to eat that. That's going to make my diabetes, you know, my blood sugars rise. And they were like, oh, it's okay. We'll just give you more insulin. When we had worked really hard to decrease her insulin numbers. So on the one hand, I want to say, you know, I agree with you guys. We definitely, absolutely can work with everyone. But I think that really depends on where you're working, because in that institution, in the institution of a hospital setting, the treatment, the food plan, it's much more rigid. It's harder to modify it according to the individual. And so that is, for me, one example of how being in an institution and having the institution narrate how, you know, what the patient is eating or what the patient is doing was not necessarily in the best interest of that patient in that regard, because her blood sugars did spike right back up, and it wasn't good, you know, because she had to increase her insulin again, and increasing insulin is not going to help control the disease. So if for any practitioner who works individualistically, we can all absolutely work together much more easily, because then we can see what needs to be done and pivot and modify things according to that and move forward, as opposed to being constrained by the larger institutions.
Right.
Do you guys have anything else to add to that? Dr. Callan, Dr. Q?
I agree with what you both said. I mean, and again, just to reiterate that we are specialists. So, you know, it's just a different category.
I mean, to me, ideally, a person or a integrative clinic is where you have an ND, an MD, you know, a nutritionist, a body worker, a Reiki worker, a therapist, talk therapist, art classes, cooking classes. We are one whole person.
Yeah.
You know,
That's
none
right.
of us should be responsible for carrying all of it, because whole healthcare covers the whole gamut. And I refer to practitioners across the board, and I'm happy to take in, once I see a patient that works a doctor, I want to talk with those other doctors, other practitioners. What are you doing to make sure that my plan is integratively working for the best interest of that patient? That's what my job is, for the patient, not to push my agenda onto anyone, but to work again integratively with everyone that person is working with, so that patient is as healthy as possible.
Right. And I think that's the beauty of a naturopathic doctor too. We see patients with GI issues, with metabolic syndrome, with infertility, all these different conditions where you have a, you know, that patient may go to a specialist that's a gastroenterologist, or may go to, you know, orthopedic doctor, you know, where naturopaths, we pretty much do all of that, but we do connect with those other clinicians to come up with care for patients.
So I got a comment, excuse me. It says, I need some information on inflammation on back and leg issues. So if you had a patient that came in with a sore back and sciatic nerve issues, or some other leg pain, back pain type issues, how do you all approach that?
Number one is diet.
What's number one is diet. Okay. What do you guys do? Dr. Thompson, Dr. Q?
Yeah. I mean, that's going to be my initial thing right there. I mean, again, it depends on the person. I need to sort of investigate, how it started happening, what's going on, what are some other factors that could be. But when we're talking about inflammation in general, I'm starting with the diet. I'm starting with the diet because I'm just convinced that is the number one thing that's causing problem between diet and stress for most people. And I think that's a jumping point for decreasing that inflammation overall. And then we can talk about how can we get to specific areas and things of that nature. Maybe using some other modalities that we know. What happened?
You're still there.
We got you.
Okay, I couldn't tell. Okay, woo, that was weird. Something popped up. I was like, wait a minute, what is that? All right. Anyway, then we can then maybe go into some other modalities, whether it be hydrotherapy or whether it be acupuncture, that can help decrease the inflammation. It could be just making some small adjustments, from a sort of physical medicine standpoint that may help to do some things, I think one of my favorite ones is using for getting, and even Chinese medicine. I'll just say that even traditional Chinese medicine, stuff like the gua sha, stuff like that, and those those things that get things flowing, get rid of stagnation, and there's a lot of things that we could talk about. I mean, and listen, that highlights what I got to keep saying this because I want to make sure everybody understands this. That's what makes us so great, man. We got a lot of tools, man. We got a lot of tools. You're not just gonna cut you over and give you some drugs, man. We got a lot of tools.
Dr. Q, we talked about diet. We said that diet was the key, and I completely agree. That's usually where I start with everybody. Anybody that I interact with, whether it's a patient or a client I'm recommending or I'm treating, whatever it is, I usually start with diet because the diet for me is foundational. What are some of the anti-inflammatory dietary recommendations that you like to make in your practice, Dr. Q?
So again, I'm all about education and teaching each person about their own body. So we kind of go through a exercise, if you will, is I'll have them do a diet diary. There, of course, are general foods that we talk about that tend to be pro-inflammatory, like your red meats, your refined sugars, the ones that we all tend to talk about. But then at the same time, I want to individualize it and have that person know what foods affect them. So we've got your food testing that happens. But through doing diet diary, let's talk about what you're eating in the morning and how do you affect it afterwards. How do you feel after you eat your cereal in the morning? Or do you feel different when you have cereal versus scrambled eggs? Because in those foods that tend to be pro-inflammatory, that tend to cause inflammatory reactions with the fried foods, so sort of thing, your body may not react the same way. So it's helpful to help them learn, how does my body react immediately? And then like 2 days later, do I from what I ate on Monday? So that you can also determine what those foods are and how much of those foods you can have going forward. So to both ends, there's general grouping of foods, or refined sugars tend to be the longest inflammatory reaction because it's essentially a poison. So your white sugars, those sweeteners, your baked goods, a lot of the breakfast foods that we have, a lot of the carbohydrates, the sugary foods, those tend to cause an inflamed reaction right away. You also have like caffeine tends to be hard on the body. Alcohol tends to be hard and toxic to every cell in the system. It's very hard for your system to flush out. Again, your fried foods and red meats just tend to be difficult for the body to break down. Large meals, I'm gonna say your happy meals, but your fast foods, those quick foods, they don't have any nutrient value at all. They basically go right through your system or they clog up things. So thinking about, again, going back to teaching patients about when I'm thinking about what to have, why do I want to have this food? Am I wanting to have this food because I'm stressed, because I'm tired, because I'm hungry? And also, what is this food going to do to me when I eat it? Is how nutrients is it? Does it have a lot? Is it like a salad, or does it have like a lot of antioxidants that? When I say antioxidants, I want to also explain that there's a certain grouping of foods that tend to be higher in antioxidants. Antioxidants can help to balance out that inflammation in your system. So your darker foods, your leafy greens, your blueberries, your blackberries, those darker produce foods tend to have those antioxidants in them. So again, thinking about what's this food going to do to me when I put it into my body. So a little bit of education helps as well.
Great. So, to answer your question, I would, as we mentioned, start with the diet for the back and the legs. I would start with modifying the diet, seeing which foods are typically more inflammatory, as Dr. Kwamina mentioned, and working to decrease some of those foods so that we can decrease the inflammation overall. Once you can decrease the inflammation overall, then you can see what's left, how much pain is left, what needs to be done, and then start to move in that regard. Let's go ahead and wrap it up. I mean, we could talk about it all day, but I know that Dr. Callens has to leave. So any last words for any of you? Dr. Callens, any last tips about anything that we talked about?
No, I think this was great information. Thank you so much for having me on the panel. Any questions or, any follow-ups that you have, feel free to reach out to me. You can follow me on my Instagram page at Dr._Callens, Callens.
Is that doctor spelled out or DR?
DR _ Callens, NMD. Or you can follow me at Dr. Rachel Callens on my Facebook page. Feel free to send any questions. I do offer a free 10-minute consultation. So any way that I can help. It's about, closing that gap for, health disparity, especially amongst the Black community. It's about, being an advocate for health, whatever I can do.
All right. Dr. Thompson, last word?
Yes, I think one of the things that I got some students out that was kind of coming in on this, so I'm going to they're gonna be kind of joining me when I'm talking this last part.
Yeah, right.
y'all hold off. Y'all just listen. Y'all gonna learn something. Hold on. So one of the last things I would say, one of the things that I'm really recommending to patients these days right now is to really give a serious consideration to going to a plant-based diet. I really want you to consider. I've actually made the decision myself. I'm actually a vegan now, and so a lot of the inflammatory markers are reduced. It decreases saturated fats. Bye-bye, Dr. Callens.
Oh, sorry.
All right. It's all right. Good to see you. All right. It reduces saturated fats. And to be honest with you, studies have shown that it has a really great way of reducing inflammation. And so I want to encourage people to just consider it. Go for 10 days.
Right.
Do vegan for 10 days. Because here's the thing: some of the things you may discover on that elimination diet that Dr. Q talked about is that some of those things that you would automatically put out on that vegan diet would automatically be gone. And I can tell you personally, I felt better than I've in a long time. Along with just making sure that you're increasing your omega-3s, whether it be if you want to be a pescatarian or whatever, eat fish, eat flax seeds, things of that nature. That's going to help. Omega-3 is a very anti-inflammatory oil. And so I want to encourage people to do that. Listen, if I can help you in any way, you can reach me on my Instagram at Whole Kingdom Wellness, at Whole Kingdom Wellness on Instagram. And I also have a website, www.wholekingdom.org, www.wholekingdom.org. You can reach me there, and I'll be happy to assist you with anything that I can help you with. All right. Thank you so much. Thank you for having me, Dr. Turshá.
All right. Go ahead and take care of your students. I appreciate you.
All right. Y'all have a great day.
And then there were two.
All
So
right.
Dr. Q, Dr. Q, last words.
Yes. So I think I agree with the plant-based diet. I wanted to add a little bit to that is I tend to see a lot of patients, my younger, my millennials, have gone vegan and they have gone off the rails. They have no protein and they don't have the nutrients. They're just like eating carbs all day. So I love the vegan life. I grew up vegetarian. I'm now, but you want to make sure that you're doing it in a way that fits for you. So following any particular trick, you just want to get much more education. For people who feel that they're inflamed and they begin to have either thinking that they are inflamed or they have a new diagnosis, start out with the basics. You may feel overwhelmed, but do what you know. Get some rest, a little movement, maybe one thing that you know that you shouldn't be doing. Do that consistently and the body can start to catch up. If you have more questions, want to reach me. Again, Indigo Wellness is my organization, and I'm on Instagram _wellness. My website
Say it again.
is Indigo
It's what wellness? It's Indigo _wellness.
Indigo, it's actually 2 underscores. Indigo and __ wellness.
Okay.
Because a first one was taken, but that's that one. And then Facebook is Dr. Kwamina ND, and that is indigowellness.net. Yeah.
All right. Hold it. I'm trying to type it in as we speak.
Oh, okay.
If someone wants to reach you.
Yes, I also do consultations, free 15-minute consultations if you want to chat and just kind of see if we're a good fit. Happy to do that. Big on coaching and taking it at your pace because I want, again, you to take an active part in your treatment and your life. It's your life, it's your body. So let's make sure you know what to do and go from there. This was fun.
Yes, absolutely. And so thank you guys. Thank you for joining me, Dr. Q, and thanks Dr. Thompson and Dr. Callens for joining me. And I just wanted to reiterate that we are all individuals. So as Dr. Johnson mentioned in the comments, we are all individuals. And so it's really difficult sometimes for us to realize that not everything is going to work for everybody. And so make sure that when you start something, you start to feel better, But then pay attention to how your body shifts so that you can pivot and start to modify even that. You may need to, start one place and then grow as you go. And that's okay. That's absolutely okay. And diet is key. So regardless of where you have inflammation and pain in your body, regardless of what the medical condition is, your diet is going to be paramount into that. So if you can begin working with a diet that is less inflammatory and then see how that works in your body, then you will be doing great things for yourself. And then contact one of us and we can definitely work with you on modifying and tweaking the diet even more. We can do some testing, we can do some elimination, we can add things, and then go from there. And so I'm Dr. Turshá Hamilton. I am your naturopathic doctor and holistic health coach. I help those who have diabetes and hypertension to live better. And that's it. I will see you guys soon. Thank you for joining us. Bye.